dan salam sejahtera. Anda bersama dengan saya Intan Nursaina dalam program Unik di mana kami memaparkan 13 episod tentang sindrom-sindrom yang ada di Malaysia. Sindrom dikesan seawal usia kanak-kanak. Namun ada sindrom yang hanya akan berlaku kepada individu lewat usia, iaitu sindrom geriatrik. Apa itu sindrom geriatrik? Teruskan bersama dengan saya. Saya kini berada di Selayang bagi bertemu dengan salah seorang pengidap sindrom geriatrik iaitu Puan Aisyah ataupun nama gelarannya Mak Ngah dan juga anak menantunya Puan Laili. Nak tahulah Mak Ngah ni sebenarnya dah pergi jumpa doktor pakar apa semua dari bila sebenarnya?
Dia pergi tu daripada 2013 rasa, bulan 1 rasa. Dia memang follow lah setiap bulan akan pergi ke hospital Selayang buat dia punya apa tu, jantung dia, kolesterol dia, darah tinggi dia, semualah.
Okey. Masa tu apa yang menyebabkan kata mungkin ada tanda-tanda dekat Mak Ngah ke yang membuatkan nak bawa pergi hospital tu?
Dia kalau miss makan ubat pun dia jantung dia jadi kita boleh tahulah dia punya tu. Kadang-kadang dia pun ada salah makan ubat. Kadang-kadang makan dia tak betul. Kita kena bagi tahulah dia.
Okey. Macam Mak Ngah sendiri, Mak Ngah tengok apa yang Mak Ngah rasa badan Mak Ngah ada masalah. Ni jantung. Lagi apa cuba boleh tak Mak Ngah ceritakan?
Mak Ngah sakit jantung dengan darah tinggi je. Lain tak ada.
Okey.
Kolesterol.
Okey. Jadi maknanya masalah kolesterol, jantung dengan darah tinggi. Jadi macam kalau doktor sendiri bila dia buat pemeriksaan dekat Mak Ngah, apa sebenarnya kata doktor?
Dia kata cuma jaga pemakanan lah. Macam dia tak boleh makan sayur banyak. Sebab kalau dia makan sayur banyak, dia darah dia cepat cair. Dia tak boleh makan benda yang berzat sangat lah. Dia makan pun boleh lah. Sayur tu boleh makan. Tapi kena ikut lah dia punya tu. Kalau dia terlebih makan, darah dia pekat. Bila darah pekat, dia akan mudah pitam.
Okey, Mak Ngah tadi ada cakap juga Mak Ngah pernah jatuh ya?
Kuno kata nak menyambut raya, gairah lah sikit. Kuno nak pasang lansir. Dia pasang lansir. Lepas tu bila dia pasang lansir, dia katil tu kan jadi tu dia terjatuh lentang kat lantai bawah tu. Macam semua adik-beradik semua terkejut lah. Dia masuk hospital jugalah. Tapi paling dia teruk sekali tu dia jatuh dekat rumah kakak saya, kakak ipar saya. Dia tengah manjat kursi.
Apa nak
buat? Dan sabu sawang kat atas kursi.
Tengok tak boleh.
Dia jenis tak boleh. Dia tak boleh tengok. Masa tu pun nak menyambut raya juga. Dia jenis macam itu. Dia nak buat apa yang dia nak buat. Tapi dia dah tua kan. Kita tak apa bagi dia buat semua. Kadang-kadang marah juga dia. Kita tak bagi dia buat apa-apa. Dia tak boleh naik tangga, turun tangga. Macam itulah. Itu hari kan dia buat union kat sini. Dia jatuh. Dia tak boleh kira penat tu dia makan masa, nak berehat tu makan masa lah. 2-3 hari itulah.
Selera Mak Ngah macam mana Mak Ngah sekarang? Selera makan?
Alhamdulillah. Tak ada apa. Makan semua boleh makan.
Dia memang tetap makan lah. Tapi kuranglah macam selalu makan. Kadang-kadang kalau tengah hari tu, tengah hari pun nasi mak lebih. Boleh lebih. Dia makan.
Selalu Mak Ngah kalau aktiviti Mak Ngah macam mana dekat rumah?
Ada jugalah, ada berjalan-jalan.
Jalan.
Pagi-pagi tu dia adalah daripada dapur, daripada depan ke dapur, ke depan. Macam itulah.
Baca Quran, baca kitab apa yang kita tahulah. Tasbih itu saja. Lain tak ada.
Dulu dia suka berkebun. Suka menanam. Durian ke, pokok petai ke, semua suka. Dia pernah jatuh longkang. Dia nak pergi potong rumput kat depan tu. Nak tanam pokok apa, entah. Kita orang dengar bunyi jatuh kan. Tu dia tak bagi dia buat apa. Sejak tu dia tak aktif lah buat apa-apa.
Ada tak senaman-senaman lain yang Mak Ngah buat?
Tak. Dia pagi-pagi ayun kaki, ayun tangan, tangan segini tarik kaki itu je lah.
Kalau buat macam tu Mak Ngah rasa macam mana? Lepas senaman tu?
Lepas tu rasa lega sikit, tak banyak sangat kan. Tidak ada perasaan nak nafas, tak boleh siapa lah.
Malah saya memang tak ada mak, tapi saya anggap mak mentua saya memang mak saya. Saya sayang dia. Saya macam mana saya sayang kat dia. Itu perasaan saya macam itulah. Apa yang dia buat semua saya nak kena tahu kan. Macam dia ajar saya masak. Semua resipi-resipi dia kat tangan saya kan. Saya belajarlah juga masak-masak kat dia kan. Saya sukalah macam dia mengajar. Bila dia dah tak ingat, kadang-kadang cakap dengan mak dia, "Mak, masak apa ni macam mana mak?" Dia tak ingat, dia tak tahu. Dia dah tak ingat. Tu rasa macam kesian mak, macam itulah.
Tuhan dah bagi kat aku ni, kata tak apalah. Syukur Alhamdulillah lah dapat anak menantu elok. Kalau tidak, nak pergi duduk zaman mana pula tahu.
Kita telah dengar kisah mereka. Namun, apa pula penjelasan doktor pakar tentang sindrom ini? Boleh tak terangkan kepada kami apa sebenarnya sindrom geriatrik ni?
Geriatric syndrome in itself is actually just a term to describe the different health conditions that an older person presents with when they're unwell. So, when an older person is unwell, it can affect their physical status, their functional status, or even their mental status. So, for example, if they have an illness, it's not like the younger adults that comes in, like for example, chest infection. They may present with cough, shortness of breath, but in older person, they may just be confused, or even they might stop walking, they may have generalized weakness. So that's the difference between the presentation of younger people as well as in older people. In Malaysia itself, we categorize geriatric population as those over the age of 60, and in sometimes hospitalization, when you think about older people coming to hospital, let's say if they go into a geriatric ward itself, they're usually taking patients above 65 years old. Yeah. But not all old people are considered, requiring geriatric medicine. So basically, those who are more frail, who requires more assessment, more comprehensive assessment, will require geriatric specialists to come into their care.
Bagaimana kita nak tahu simptom-simptom dia?
Yeah. So if you think of the older person that requires geriatric care itself, then they're usually older people who are more frail, those who have multiple medical illnesses, especially those who take a lot of medications. Yeah. So this group of older person, if they become unwell, they may have non-specific symptoms. So they may complain of, being confused. Family members might say that, oh, they've changed in their mental status, they're very confused now. Or they may be unsteady on their feet, they may fall at home, or they may stop getting out of bed or doing less. So there's a disruption to their physical status.
Okey, jadi gabungan penyakit-penyakit macam mana selalunya yang ada dalam geriatrik ni, doktor?
So the older people that we see commonly have illnesses that are multiple chronic illnesses. So we see people who may have dementia, ones who may may also have problems with stroke, Parkinson's disease, and as well as people who have recurrent falls and even bone fractures. So if you've seen any older person who may have these illnesses on top of their multiple chronic illnesses, then we think that they should be better assessed by a geriatrician.
Alright. Jadi kalau pesakit ataupun kita panggil pengidap geriatrik mungkin pesakit ataupun pengidap dia adalah penyakit ataupun hanya a syndrome geriatrik, macam kita nak kategorikan dia?
Yeah, so they are mostly a syndrome in itself lah. So for example, as our body is very clever in adapting to different changes, so our physiological status will ensure that our system is stable lah. So as we get older, in an older person, these ability to adapt to stress or to changes will be disrupted, and hence they can easily develop geriatric syndrome itself. So it's important to identify the syndrome and to understand that if, for example, I'll give you an example, if a patient who has fallen. So fall is not a penyakit, I mean, it's not a disease itself. But then again, there are many causes to this presentation of the syndrome. It could be that they may have changes in their brain function, degenerative changes, changes with their vision, or over medication, medication that they've taken for like 20 over years, but because of the body changes, it may not all be suited to continue on.
I see.
Yeah, even weakness in their muscles, so lack of nutrition and all that can contribute to that fall that they have.
What's the factors, doctor? Is it the age or the energy or how?
It's a combination of many different factors itself, because every body system of us undergoes changes as we age. And I think contributing with, if you also carry along with you many chronic illnesses as you get along in age, then all this can go into disruption, especially if you suddenly have an acute problem. So let's say if you've got an infection, then it all crumbles very easily.
Okay.
Yeah, so and when they present, they may present with this geriatric syndrome.
Okey. So jadi selalunya pengidap geriatrik yang kita baru hantar mungkin pertama kalinya datang ke pakar geriatrik, apa agaknya yang akan dilakukan? Bermakna proses bagaimana yang dilakukan?
Okay. When we assess a person who may present with geriatric syndrome, we do a very comprehensive geriatric assessment, and that actually requires a discussion with the patient and the family members. We want to know all their medical health histories. We want to know what medication that they're taking. We also want to know how these medical problems that they have affect their function.
Rawatan, terapi dan sebagainya itu adakah di bawah pakar geriatrik sendiri ataupun akan disalurkan kepada pakar-pakar lain? Kalau terapi dengan pakar terapi yang biasa yang bahagian mereka atau bagaimana?
Usually, if there are issues with the health of the older person, the geriatrician normally becomes the advocator. So we are the ones that will do our best to maintain their health status. But if they require referral to other specialists, we will do that. But at the same time, we will usually be the ones who manages their overall care itself. So even if they are referred to therapists, the therapist normally reports back to us to tell us the progress so that we can then treat accordingly.
Apa agaknya perubahan-perubahan ketara yang boleh kita lihat kepada pengidap geriatrik ni?
So the common geriatric syndromes that we see are confusion in the older person, memory is not so great, behavioral changes, older person who has fallen or keep falling at home. Even if it's a minor injury, there is something that's not going right. They need to be assessed. Older person who suddenly become incontinent, and they are worried about going out of the house. Older person who has lost interest or stopped doing what they used to be doing before, or when they have increased dependency, then there is a sign that they need to see someone about it.
Untuk kita mengelakkan, bukanlah kalau dah jadi tak boleh buat apa, betul kan doktor? Tapi untuk kita mengelakkan menjurus ke arah geriatrik ni, apa nasihat dan juga tips doktor?
Okay. So basically, if you look at our life as a whole, we've got early childhood, then we have got middle life, and we have got, older, later stages. So there is definitely something you can do throughout your life journey itself. So for example, even for younger children, we would suggest that, you continue to give them good education, stimulate their mind, and when you reach middle age itself, ensure that you maintain a good body mass index, you avoid being obese, and at the same time, things like if you have a health problem, it needs to be controlled. At the same time, we find that even in middle life, that if a person has mental health disorders such as depression, it has to be treated.
Okay.
Yeah. So as you reach later life, even if you find that there's so many things or so much time that has gone by, but there are still things that you can do to change. So if you've got chronic health problem, you want to maintain a good control of the chronic health problem, as well as you're never too old and it's never too late to exercise. There are many different things that you can do, and continue to stimulate your mind, continue to have a good social interaction with people around you. Don't be socially isolated. You need to mix with other people, and you need to know what is going around you. You don't want to forget what the date, the time is, because it doesn't matter to you. You need to keep in touch with things around you.
Begitulah tadi perkongsian dari Dr. Kor tentang sindrom geriatrik. Bermakna sindrom geriatrik ini adalah gabungan beberapa perkara, antaranya masalah gangguan tidur, masalah demensia, masalah pergerakan dan sebagainya. Jadi jika ada ibu bapa kita di luar sana yang mempunyai simptom-simptom ini, bawalah mereka membuat pemeriksaan dengan segera.
Saya tak pernah dengar. Sindrom geriatrik saya tak pernah dengar. Tapi kalau sindrom Down macam tu saya pernah dengar.
Geriatrik saya tak pernah dengar. Geriatrik.
Orang yang berpenyakit sindrom ni, dia perlu banyak bimbingan daripada orang awam, daripada family.
Amalan Gaiduk Sihat ni bukan semata-mata terletak di bahu Kementerian Kesihatan. Dia cross ministries, di mana semua kementerian harus bersama-sama untuk menerapkan nilai-nilai pendidikan, pengajaran, pengamalan Gaiduk Sihat dalam setiap aktiviti program yang disusun oleh setiap kementerian. Jangan lupa untuk memasukkan elemen membawa masyarakat sihat sejahtera. Ya, bila kita masyarakat ni tidak sihat, kita akan mendedahkan diri kita kepada faktor risiko yang tinggi. Kita kena memberitahu kepada masyarakat untuk mengenali bahawa wujudnya penyakit rare disease ini. Jadi peranan kita adalah memberitahu bahawa penyakit ini ada. Sedikit sebanyak ilmu tentang penyakit rare disease itu dapat kita ketengahkan. Jadi orang kata nak membuka mata supaya di masa kita merawat penyakit-penyakit yang lain, kita juga harus tidak ketinggalan di dalam mengambil bahagian untuk merawat pesakit rare disease ini. Penyakit rare disease ni dia diistilahkan agak lewat. Ya, dia adalah himpunan penyakit-penyakit 7,000 penyakit. Kita tak tahu nak cakap sakit apa itu sebab dia sangat rare. Ya, jadi kita golongkan dia dalam keluarga besar rare disease. Peningkatan tahun demi tahun, mungkin persentasenya tak tinggi, tapi ada meningkat. Di situ timbul kesedaran untuk meletakkan dia di bawah tumpuan. Bahawa kita perlu melakukan sesuatu. Jadi saya rasa kerana dia agak baru, jadi sampai kepada pengetahuan masyarakat pun baru pada tahap peratus yang mungkin kurang. Kementerian Kesihatan sentiasa mempertingkatkan usaha-usaha untuk menambah banyakkan lagi informasi, bahan-bahan maklumat tentang rare disease. yang boleh dicapai melalui portal My Health KKM. Jadi ambil pedulilah dengan saranan kita dan utamakanlah kesihatan supaya kita dapat mengecapi kesihatan sihat sepanjang hayat, ya. Dan biar kita dapat bersyukur, ya, di atas nikmat kesihatan yang Tuhan berilah.
Tapi saya rasalah kalau kat orang luar kat sana, kalau ada mak macam ni, jagalah baik-baik. Dia bukannya ada lagi. Kalau dia tak ada, kita terasa sangat-sangat.
Healthy and active is very important. So I always tell my older folks that even if you retire, don't stop there. Don't just sit at home and do nothing and stop learning. No, you have to always keep your mind active. You have to find new things to do, things that you like to do. So you keep your cognition always stimulated. Yeah, the other things are like what I've mentioned, physical activity, physical exercise will be also very important. Because only if you have a healthy body, you can have a healthy mind.
Diharap apa yang kami bawakan pada minggu ini dapat memberi sedikit maklumat dan juga kesedaran kepada kita semua tentang kewujudan sindrom ini. Jadi sampai di sini sahaja. Terima kasih dari kami, tim produksi Unik. Sehingga jumpa lagi. Assalamualaikum.